Good morning, Professor Charlie Su. I'm from KMCRIC, the Korean Medicine Convergence Research Information Center. Thanks for joining the interview.
Good morning.
You majored in Chinese medicine in China. What made you come to RMIT Australia?
Thank you for the question. I did Chinese medicine in China between 1982 and 1987. And upon completion, I was offered a job at the university to become academic. And I was looking for opportunity to do my postgraduate. So I came to Australia to do my master's by research and my PhD.
So you've been researching in this school since 1994, am I
Yes.
right? Okay.
Yep.
Could you tell us about some of your major achievements in this area?
I have divided my work into 4 areas. The first one is to develop degree programs. Yeah, so we have developed a double bachelor degree in Chinese medicine, that's a Bachelor of Health Science and Bachelor of Chinese Medicine, which is a 5 year double degree program. We also developed 2 master postgraduate coursework programs, one in acupuncture, one in Chinese herbal medicine. Obviously, we have also have master by research and PhD programs. But if looking into this development is the educational development, we focus on a number of areas. The first one is to focus on a very strong base in Chinese medicine. The second area is really to focus on very strong clinical training. So students receive training both in Australia and overseas, some in Taiwan, some in mainland China. We also focus on introducing a very strong components in research. So students learn about research method, learn about how to critique literature, and to integrate literature into Chinese medicine learning and practice. We also focus on integration of biomedical sciences and traditional medicine. So those are the learning teaching development. What I can say is the program now at RMIT is the largest program and most popular in Australia. Yeah, and we have produced more than 40% of the Chinese medicine practitioners for Victoria. So that's in teaching and learning. In research, I have set up a large research center over the last 20 years at RMIT, which we have published more than 300 SCI papers over the last 20 years. And we have also trained about 30 PhD graduates, and then we have also very actively participating in conferences in Australia and overseas in traditional medicine, complementary medicine. The center has been recognized by the World Health Organization as a WHO collaborating center. Also recognized by the Chinese government as a Confucius Chinese Medicine Center, as well as we have a joint research center with the Guangdong provincial government. In terms of other 2 achievements, one is my contribution to international organizations, like to the World Health Organization, to other groups like ICCMR, like CGCM. So all those are important organizations internationally promoting Chinese medicine development. Finally, I would say my contribution to the community and to the government in Australia. I have been an active player in promoting standard development in Australia and also regulation of Chinese medicine. From 1995 to year 2000, I was a member of the reference group for the government review committee. From 2000 to 2012, I was a member and then vice president of the Chinese Medicine Research Board Victoria. From 2011, I have been appointed by the state ministers and Commonwealth Health Minister to be the national chair for Chinese Medicine Board of Australia. So I have been involved in a lot of things in regulation, in government work, international organization, as well as my teaching and research.
Okay. So how do you manage the integration of Chinese medicine and other areas of studies? How do you approach this?
I think my clinical research has been the most important part that I managed to use both approaches in Western medicine and Chinese medicine to ensure that the correct diagnosis is made before any inclusion of patients into clinical trials, which has been quite successful because many of my projects have been funded by the Australian National Health and Medical Research Council. And most of my projects, I work closely with medical practitioners and medical experts. The really important thing is that you need to have a very strong base of scientific methodology. And with the methodology that requires a very clearly described inclusion exclusion criteria, the relevant biostatistical analysis, and also the meaningful interpretation of data. You need to bring the two systems together to ensure that you are generating valid data, answering important questions, and that can be used to enhance future practice.
So, as the head of College of Science, Engineering and Health at RMIT University, what is your future vision? How are you going to lead the area of health science in the future?
My role is the head of School of Health Sciences. That includes all academic disciplines to do with health at RMIT University as part of the College of Science, Engineering and Health. My role is really to provide a clear vision about our programs and our academic disciplines can contribute to major national and international health challenges. And we identify areas that we may be able to contribute through our school. Two areas. One is the rapidly aging population. And the second one is patients with chronic diseases. For example, like musculoskeletal pain, like cancer, like cardiovascular, like respiratory disease, like diabetes and obesity. So we focus on a number of those areas to have a relative narrow focus for research, however, that link to our major teaching programs.
So for the last question, in Korea there are more than 20,000 Korean medicine practitioners and more students and scholars. Is there anything you want to say to these people?
I think Korean medicine and Chinese medicine share broadly a common theoretical framework and clinical approaches. And there has been very active exchange between the traditional medicine personnel, including practitioners, academic students in the region. I think lots of work has been done by the World Health Organization Western Pacific Regional Office, because this area is the most important area for traditional medicine development, including Chinese medicine, Korean medicine, or sometimes they just simply call it TCM. My suggestion would be like 4 areas. I think the 4 important areas you need to consider. The first one is to continue to build international collaboration. So I understand in China there are more than 300,000 Chinese medicine practitioners. In Australia we have 4,500. So all the expertise in the region in different countries, we need to work together because everybody would gain more if we work together. The second thing is like continue to develop high quality teaching programs because that's really important to make sure that practitioners came out from those programs, from those universities in Korea, are adequately prepared to do their work in the community. The third thing I think really important is to work with other healthcare professions. So don't try to see Korean medicine or Chinese medicine as an isolated profession. You need to work with other healthcare professionals, with the medical, with the dentists, with the physiotherapists, because all therapeutic approaches have their limitations. And by working together, I think we all able to work together to make a more meaningful contribution to the community. And last but not least is really need to focus on research. And particularly important is using evidence-based medicine framework to determine the benefit and risk and cost of Chinese medicine and Korean medicine. So if you focus on all those four areas all together, by working together internationally, by developing program, by doing research, by working with other healthcare professions, I think the future for traditional medicine like Chinese and Korean medicine is very good.
Thank you so much for this interview.
You're most welcome.